Like we're doing a full eye examination today. Does that sound right? Okay. All right, so let's get started. So first I'm just going to observe your pupils, looking at the size of the pupil. Most people's pupils are between 3 and 5 millimeters in diameter. It's pretty standard range. And then I also just want to check for roundness, make sure the pupils are round in shape. And then I'm also looking for symmetry, and just comparing the left eye to the left pupil rather, to the right pupil. Okay. So now I'm going to perform a light test. This is called a pupillary reflex test or pupillary response test. And this is going to involve me shining a light into your eye. It will be bright, but it shouldn't be uncomfortable or painful or anything like that. Is that okay? All right. All right, so I'm going to start with your left eye, and I'm just going to check the direct response of the pupil. And we'll see how your left pupil reacts. So, as I shine the light into the left eye, I'm looking to see if the left pupil constricts, with looking to see, to verify that the pupil constricts when I shine the light into it. All right, and it does seem to be responding appropriately and consistently. So now I'm going to continue shining the light into your left eye, but I'm going to be checking the right eye to see how it responds when I shine the light into the left eye. So this is called a consensual response. And basically what that means is that when I shine this light and stimulate the left pupil, causing a reaction there, that the right pupil basically just follows along and does the same thing. And that's part of the symmetry that I'm checking for as well. So we've got good direct response on this left eye, and we also have a good consensual response. So now I'm just going to do your right eye, and doing your right eye and doing the same thing on this side. So starting with direct response, and like I said, just doing the same thing again and making sure that when I directly stimulate the pupil with a light source, that it responds by contracting in size or shrinking in diameter. So I'll test that one a few more times. It's looking good so far. Responding in a normal range and very consistently. All right. And so now I'll just do the consensual. So shine the light in the right eye and look for to see how the left pupil responds. Okay. So the direct on the right eye, right pupil looks good. And so does the consensual. So now I'm going to perform a similar test. Basically checks for the same thing, but it's just a different way of performing the test. So it'll help me to verify the results that we just did from the first test. So what I'm going to do now is swing this light from one eye to the other and just checking for the same thing, that the pupils contract and reduce in size, both eyes evenly when I swing from eye to eye. So I'll do that now. So we go left to right, to left, to right, and just do a couple seconds on each side, 1 or 2 seconds, and just making sure that both eyes are responding evenly. Yeah, so that is looking pretty good as well. All right, yep. Direct response, consensual response. All right, that looks pretty good. Okay, so now I just need you to focus on my finger. And I'm going to slowly bring my finger towards your face and just continue focusing on it for me. And bring it back down, just keep focusing. So what I'm looking for here is to make sure that your pupils track properly. That they're directing themselves inwards towards your nose to continue to focus, and that they are doing so symmetrically, evenly. And so far, everything's looking good, tracking how they're supposed to. Okay, that's good. Okay, so now I just want to, I'm going to shine a light in your eyes again. And this time I want you to tell me if, I'll start with your left eye. So I want you to tell me if the light looks as bright in your left eye as it does in your right eye. Okay? So start with the left eye. So does this look as bright as this. Do again. Okay. So does this look as bright as this? This as bright as this. Having a hard time telling. Does one side look brighter than the other? Okay, that's fine. We can keep doing it. So there's that. Which side looks brighter? Okay, so if that's 100%, how much would you say that is? All right, do again. So 100% left eye. How much is that in comparison? 95? Okay, well, that's pretty close. It's kind of a subjective kind of test anyway, but we just like to use it to check, to at least give some kind of gauge if one eye is picking up more light than the other, or but a 5% difference is pretty minor, especially on that subjective level. So I think you're okay. All right. Okay, now we're going to test what's called red desaturation. So what I want you to do is cover up your right eye. Okay. Okay. Now, can you tell me what color this is? Red. Okay, perfect. And cover up your other eye. And now, can you tell me what color that is? Red. Okay, perfect. So you can uncover your eye. Okay, now what I'm going to do is I'm going to pass this in front of your entire field of vision. And what I want you to look for is a change in the tone of this red. So if at any point it looks more red, less red, different color, anything like that, just let me know, okay? So pass this over your entire field of vision. So all we're looking to do here is just make sure that there's no point where you're not able to see this red, just as you were, as the same color, just as. So does that look good? It's not changing. Stays the same. Looks the same. Looks good to you? Okay. All right, awesome. Okay, so now I'm just going to take some measurements of your eyes. All right, so you can just relax and just going to measure here. Okay, so there's that. There. Let's see. All right, so just hold real still for me. Take some measurements here. And all right, there's that. Yeah. Okay. Mm-hmm. All Okay, so now if you can just close your eyes for me, I just want to check. Gently place my thumbs on your eyelids. I just need to check the pressure of your eye, make sure that feels even, and like an appropriate amount of internal pressure there. Okay, so just close your eyes. Check that. All right, that's good. And just keep them closed. I'm gonna feel the bony ridge here along the eye. Just make sure that I don't feel any crepitus or anything that would be cause for concern. And that feels pretty good. So you can open your eyes. All right, that felt good and healthy. So let's test your motility. So I just need you to focus on my finger again, and now we're just, I'm going to move it, and I want you to just follow my finger wherever it goes, okay? Good. Yep, just keep following the finger. Just testing for full range of motion of the eyes. Make sure you're not moving your head. And just using your eyes to follow my finger. All right, that is looking really good. Normal range. Very healthy. All right, perfect. Now I'm going to flash. I will focus on my face, focus on my nose, center of my face. I'm going to flash a number via fingers on just one hand. And I want you to stay focused right here and tell me how many fingers I'm holding up. Don't look at the hands, just stay focused here. Okay? And I'll only raise fingers on one hand at a time. Okay? Good, 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 good. Yep. Mm-hmm. All right. All right. That's good. All right. Now go ahead and cover up your right eye for me. Just tell me when you can see my fingers. Good. 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 All right. That's perfect. Switch eyes for me. All right, and just tell me when you can see my fingers. Good, 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 good. That's perfect. Okay, and now I'm just going to get real close and take a good look into your eye, okay? Okay. And look up for me. Awesome. Look down for me. Perfect. Left and right. Okay. And look up and look down. Left and right. Okay, perfect. All right. Now, if you don't mind just turning and facing this way for me, we're going to use an eye chart to make sure that your vision is 20/20. And then we'll be all set. And everything has looked good so far. So um, once we get done with the chart, then you'll be good to go. Okay, so I'm going to have you read this chart, and we're going to do one eye at a time. So start, cover up your left eye for me, and read the top line. Good. Second line. Good. And third line. It's good. And the fourth line. Okay. Okay. And the bottom line. Okay. Swap eyes for me. Top. Second. Third. And the fourth. And the last line. Okay. And then let's use both eyes. So uncover your eye. Yep, both eyes. So top line. TOC. Second line. Yep. LPED. Third line. PECFD. Fourth line. EDFCZP. And last line. FELOPZD. Yep. All right. Well, it looks like your vision's spot on. So, yeah, that concludes the examination.